Alberta Health Services. Healthy Albertans, healthy communities, together.
And good afternoon, everyone. I am David Wyant, Chair of the Alberta Health Services Board, and I would like to welcome you to this AHS Public Board meeting. Thank you for taking the time to join us. This is a meeting of the Board to consider 9 motions. To start, in the spirit of promoting reconciliation and gratitude, and in keeping with the calls to action from the Truth and Reconciliation Commission, on behalf of the Board, I would like to take this opportunity to acknowledge that the work of Alberta Health Services takes place on historical and contemporary Indigenous lands, including the territories of Treaties 6, 7, and 8, and the homeland of the Métis. I would also like to acknowledge the 46 First Nations communities within what we call Alberta, as well as the Métis and Inuit peoples who form an important part of our healthcare system. Our board members are joining us from across the country, and we acknowledge the Indigenous peoples' territories in which they live and work as well. We are grateful to those who have come before us, and we are mindful of those who will follow us as we steward and protect these lands. Before we get to the business of the day, Dr. Verna Yu would like to share some information about the rollout of the COVID-19 immunizations for children ages 5 to 11, which starts tomorrow. First, though, allow me to again pass on my expressed gratitude to healthcare workers from across the province for helping Alberta through the 4th wave of the pandemic. The health system was under unprecedented pressure, and for a time, AHS was operating at nearly 200% of its normal ICU capacity. Thanks to the hard work, dedication, and ingenuity of our staff and physicians, the system was able to manage the surge in severely ill Albertans with COVID-19. And although AHS planned for critical care triage, I am truly relieved and grateful that it did not have to be implemented. There is a great deal of work, contingency work and planning that goes on behind the scenes, and if all goes well, as it usually does, is never seen by the public. It is nonetheless important and crucial to the success of our system. I am pleased to see hospitalization and ICU numbers drop over the past few weeks and to see postponed surgeries being rescheduled. Yet although we are generally trending in the right direction, COVID-19 is still here. I would like to again encourage all Albertans to continue following public health measures, and if they haven't already, to book and receive their COVID-19 immunizations. Experts here in Alberta, throughout Canada, and around the globe have confirmed that it is the safest, most effective way to protect yourself and others from the virus. By doing so together, we can work to prevent a potential 5th wave. As I mentioned earlier, a new group is now eligible for the COVID-19 vaccine, and I will invite Verna to talk about the vaccine rollout to children ages 5 to 11. Verna?
Great, thanks very much, David, and good afternoon to everyone. I'm very pleased to have an opportunity to talk today about the COVID-19 immunization rollout for children ages 5 to 11, which starts tomorrow. I know that many Alberta parents have been waiting patiently to vaccinate their young children, while others might want more information before they book an immunization appointment for their kids. The vaccine that Pfizer has tailored specifically for children 5 to 11 has gone through a rigorous review since it was first submitted to Health Canada more than a month ago. Health Canada conducted an independent and thorough scientific review of the data, which show the benefits of the vaccine outweigh the risks in this age group. The assessment includes a detailed review of clinical trial results, as well as other evolving data and information about the health impacts of COVID-19 and variants of concern on children in Canada. Only then did Health Canada authorize the use of this vaccine for Canadians ages 5 to 11. It will protect children from the virus, reduce the risk of them spreading the virus to others, and enable them to once again do all the things that kids love to do. You can now book an appointment for children in this age group through the province's online booking system at alberta.ca/vaccine or by phoning HealthLink at 811. Children ages 5 to 11 will start receiving the vaccine starting tomorrow, and there is enough vaccine supply so every parent who wants to get their child a first dose will be able to do so. COVID-19 vaccinations for 5 to 11-year-olds will take place at 120 AHS clinics across the province. They will also be administered at a limited number of pharmacies where AHS clinics are not close by. Children who live on a First Nations reserve can also get immunized at public health clinics and nursing stations on reserve. Doses for these children will be 1/3 of the dose for adults, and 2 doses are needed to be considered fully immunized. Second doses will be administered a minimum of 8 weeks after the first dose, as current data suggests that the period of time between doses provides the strongest immune response. If you still have questions about the vaccine, I encourage you to visit a new webpage that we've created, ahs.ca/vaccinekids, that provide parents, guardians, and families with current information and resources to help them make an informed decision about immunization. You can also talk to your healthcare provider about any questions you may have about the vaccine and COVID-19 immunization for yourselves and your loved ones. I'd like to close by reiterating what David said earlier. COVID-19 immunization is the safest, most effective way to protect yourself and others from the virus and help us put the pandemic behind us once and for all. If you haven't been fully vaccinated yet, please visit alberta.ca/vaccine or phone HealthLink 811 for an appointment. Thank you very much, and back over to you, David.
Thank you, Verna. We are participating by telephone conference today. When I ask for a vote on a motion, I will ask for those opposed or abstaining. For those who neither oppose nor abstain, I will take it that you are in favor of the motion. If there are none or a minority who either oppose or abstain, I will declare the motion carried. May I ask that someone move approval of the agenda that has been circulated?
This is Saye Zoki. I so move.
Thank you, Saye. Will someone second the motion?
Sherry Fountain. I will second the motion.
Thank you, Sherry. Any further discussion? Any opposed or abstentions? The motion is carried. Based on the approved agenda, do any board members have a conflict of interest that they would like to declare at this time?
Mr. Chair, this is Saye Zoki. I'd like to declare a conflict of interest on item 2C, radiology contracts under Finance Committee, given my role as a physician.
Thank you, Dr. Zelke. I will ask that the Corporate Secretary note that in the minutes, your abstention, so that you need not again mention it when we come to that matter. With that declaration, we will move on. In the board materials were minutes for approval, and it's the September 17th, 2021 public board meeting. May I have someone move approval of those minutes?
It's Hartley Harris. I move to approve the minutes.
Thank you, Hartley. Will someone second the motion?
Natalia Ryman. I second that motion.
Thank you, Natalia. Any further discussion? Any opposed or abstentions? The motion is carried and the minutes are approved. I will now ask Vicki Yellowold-Woman, Vice Chair of the Finance Committee, to present the Finance Committee report and related motions.
Thank you, Chair. The Finance Committee met on November 18th, 2021. The committee received an update on the multi-year outlook. The committee also reviewed its terms of reference. The committee considered 5 items for recommendation for approval of the board. First, the committee reviewed the terms and conditions of an amendment to the DynaLife Laboratories Consolidation Agreement and recommended same for board approval. Board approval is required in accordance with Policy 1100, Delegation of Authority and Establishment of Controls for Commitments. The board has considered such recommendation and the members support its approval. Accordingly, I move that the Alberta Health Services Board, 1, approve the amendment of the DynaLife Laboratories Consolidation Agreement on the terms and conditions reviewed by the Finance Committee and the Board with such non-substantive changes that management of Alberta Health Services considers necessary or advisable. And 2, delegate the authority to the Alberta Health Services President and CEO to execute the documents that give effect to the amendment on behalf of Alberta Health Services in accordance with the delegation of authority and establishment of controls for commitments and policy. I so move.
Thank you, Vicki. Will someone second the motion?
I will second the motion. It's Jack Mintz.
Thank you, Jack. Any further discussion? Any opposed or abstentions? The motion is carried. Vicki, your second motion?
Second, the committee reviewed the renewal of the contract between Alberta Health Services and Enmax Energy Corporation and recommended same for board approval. Board approval is required in accordance with Policy 1100, Delegation of Authority and Establishment of Controls for Commitments. The board has considered such recommendation and the members support its approval. Accordingly, I move that the Alberta Health Services Board 1 approve the 1-year extension of the contract with Enmax Energy Corporation effective January 1, 2022 regarding the provision of retail electricity services to Alberta Health Services on the terms and conditions reviewed by the Finance Committee and the board with such non-substantive changes that management of Alberta Health Services considers necessary or advisable, and 2, delegate authority to the Alberta Health Services President and Chief Executive Officer to execute the documents that give effect to the 1-year extension on behalf of Alberta Health Services in accordance with the delegation of authority and establishment of controls for commitments policy. I so move.
Thank you, Vicki. Will someone second the motion?
I will. This is Heidi Overgaard.
Thank you, Heidi. Any further discussion? Any opposed or abstentions? The motion is carried. Vicki, your third motion.
Third, the committee reviewed proposed amendments to the Alberta Life Care Housing Foundation, amended and restated Master Services Agreement, and the Heights Pioneer Assisted Living, Inc. Master Services Agreement, and recommended same for board approval. Board approval is required in accordance with Policy 1100, Delegation of Authority and Establishment of Controls for Commitments. The board has considered such recommendation and the members support its approval. Accordingly, I move that the Alberta Health Services Board 1 approve A, amendments to the Alberta Life Care Housing Foundation amended and restated Master Services Agreement to renew the following continuing care service agreements for 5 years. I, Lifestyle Options White Mud for 80 supportive living spaces and integrated home care. 2, Lifestyle Options Leduc for 76 supportive living spaces and integrated home care. 3, Lifestyle Options Terra Losa for 74 supportive living spaces and integrated home care. On the terms and conditions reviewed by the Finance Committee and the Board, with such non-substantive changes that management of Alberta Health Services considers necessary or advisable. B, an amendment to the Heights Pioneer Assisted Living, Inc. Master Services Agreement to add supportive living services at the new Pearson Place facility for a total of 75 supportive living spaces for a 30-year term on the terms and conditions reviewed by the Finance Committee and the Board, with such non-substantive changes that management of Alberta Health Services considers necessary or advisable. And 2, delegate the authority to the Alberta Health Services President and CEO to execute documentation to effect such amendments referred to above on behalf of Alberta Health Services in accordance with the delegation of authority and establishment of controls for commitments policy. I so move.
Thank you, Vicki. Will someone second the motion?
Natalia Ryman, I second that motion.
Thank you, Natalia. Any further discussion? Any opposed or abstentions? The motion is carried. Vicki, you have a fourth motion?
Yes. The committee reviewed the interim authorization to spend for COVID costs in 2021-22 and recommended same for board approval. The board has considered such recommendation and the members support its approval. Accordingly, I move that the Alberta Health Services Board approve the amendments to the authorization to spend related to costs for the COVID-19 pandemic response previously approved by the Alberta Health Services Board on August 30th, 2021, COVID authorization to spend to provide the following. 1, the interim authorization period under the COVID authorization to spend be expended to end on January 31, 2022 rather than November 30th, 2021. 2, the maximum expenses under the COVID authorization to spend be increased from $989 million to $1.112 billion for the extended period April 1, 2021 to January 31, 2022. And 3, the maximum capital expenditures under the COVID authorization to spend remains at $28 million for the extended period April 1, 2021 to January 31, 2022. I so move.
Thank you, Vicki. Will someone second the motion?
This is Saye Zokia. I second the motion.
Thank you, Saye. Any further discussion? Any opposed or abstentions? The motion is carried. Vicki, you have a fifth motion?
Yes. Lastly, the committee reviewed the terms and conditions of a memorandum of understanding between AHS, medical imaging consultants, and radiology and diagnostic services, and contracts between Alberta Health Services and each of medical imaging consultants and radiology and diagnostic services, and recommended same for board ratification and approval. The board has considered such recommendation and the members support the ratification and approval. Accordingly, I move that the Alberta Health Services Board, 1, ratify the Memorandum of Understanding between AHS, Medical Imaging Consultants, and Radiology and Diagnostic Services dated November 10th, 2021. 2, approve Alberta Health Services entering into the Diagnostic Imaging Services Agreement with each of Medical Imaging Consultants and Radiology and Diagnostic Services on the terms and conditions reviewed by the Finance Committee and the Board, and such non-substantive changes that management of Alberta Health Services considers necessary or advisable. And 3, delegate the authority to the AHS President and CEO to execute the Diagnostic Imaging Services Agreements described above on behalf of Alberta Health Services in accordance with the delegation of authority and establishment of controls for commitments policy. I so move.
Thank you, Vicki. Will someone second the motion?
David, I will second that motion. It's Sherry Fountain.
Thank you, Sherry. Any further discussion? Any opposed or abstentions? The motion is carried. I will now ask Vicki again, but this time as chair of the Community Engagement Committee, to please present the Community Engagement Committee's report. Vicki.
Thank you, Chair. The Community Engagement Committee met on November 19th, 2021. The committee received an update on the status of the AHS philanthropic and honorific naming and recognition policy. The committee also reviewed its terms of reference. The committee considered 3 recommendations for approval of the board relating to new appointments and term renewals of advisory council members, the appointment and reappointment of trustees to established foundations, and approval of interim appointments of trustees to the Alberta Cancer Foundation. We are very grateful for the commitment of our volunteers across the province. We value their work and appreciate their commitment to health care. As is our typical practice, given the number of appointments and renewals, the names of the members and trustees will not be read in this meeting, but will be incorporated into the minutes of the meeting and posted publicly following this meeting. First, the committee reviewed new appointments and term renewals of members to advisory councils. The responsibility to appoint advisory council members lies with the AHS board. The committee recommended the board approve the member new appointments and term renewals as reviewed by the committee. The board has considered such recommendation and the members support its approval. Accordingly, I move that the Alberta Health Services Board approve the appointments and renewals of members to the advisory councils for the terms reviewed by the Community Engagement Committee and the Alberta Health Services Board. I so move.
Thank you, Vicki. Will someone second the motion?
It's Hartley Harris. I second the motion.
Thank you, Hartley. Any further discussion? Any opposed or abstentions? The motion is carried. Vicki, you have a second motion from this committee?
Yes. The committee reviewed the appointments and reappointments of trustees to foundations. The responsibility to appoint trustees to establish foundations lies with the AHS board. The committee recommended the board approve the trustee appointments and reappointments as reviewed by the committee. The board has considered such recommendations and the members support its approval. Accordingly, I move that the Alberta Health Services Board approve the appointments and reappointments of trustees to health foundations for the terms reviewed by the Community Engagement Committee and the Alberta Health Services Board. I so move.
Thank you, Vicki. Will someone second the motion?
Jack Mintz seconds the motion.
Thank you, Jack. Any further discussion? Any opposed or abstentions? The motion is carried. Vicki, your third motion from this committee, please.
Yes, thank you, Chair. The third and final motion, the committee reviewed a request by the Alberta Cancer Foundation to approve interim appointments for their board trustees to align their terms to a common end date. The committee recommended the board approve the trustee appointments as reviewed by the committee. The board has considered such recommendation and the members support its approval. Accordingly, I move that the Alberta Health Services Board approve the interim appointments of trustees of the Alberta Cancer Foundation for the terms reviewed by the Community Engagement Committee and the Alberta Health Services Board. I so move.
Thank you, Vicki. Will someone second the motion?
I'll second it, from Heidi Oberberg.
Thank you, Heidi. Any further discussion? Any opposed or abstentions? The motion is carried. I will now ask Sherry Fountain, Chair of the Governance Committee, to present the Governance Committee report. Sherry?
Thank you, David. The Governance Committee met on November 17th. The committee received the Ethics and Compliance Office 2020-2021 Q4 report, a report on red tape reduction, and discussed the mandate and roles document renewal process, and the 2021 board skill set analysis results. The committee also received an overview of the requirements and process with respect to Accreditation Canada governance standards. The committee considered one item for recommendation for approval of the board. The committee recommended amendments to the terms of reference for the board member. The board considered such recommendation and the members support its approval. Accordingly, I move that the Alberta Health Services Board A. Approve the amended board member terms of reference as reviewed by the Governance Committee and the Alberta Health Services Board, and B. Direct management to post the revised terms of reference on the Alberta Health Services public website.
Thank you, Sherry. Will someone second the motion?
Natalia Ryman, I second that motion.
Thank you, Natalia. Any further discussion? Any opposed or abstentions? The motion is carried. I will now ask Jack Mintz, the chair of the Audit and Risk Committee, to present the Audit and Risk Committee report. Jack?
Thank you very much, David. The Audit and Risk Committee met on November 18, 2021. The committee received the 2021 to 22 Office of the Auditor General Audit Plan and the financial reporting to Alberta Health, the quarterly summary of enterprise risk management, the annual internal audit and enterprise risk management performance report, and an investigation summary report. The committee also reviewed its terms of reference. There are no items that came through the committee for board approval.
Thank you, Jack. I will now ask Dr. Saye Zelke to present the Human Resources Committee report. Saye?
Thank you, Mr. Chair. The Human Resources Committee met on November 24, 2021. The committee received a labor relations update, the Our People Results quarterly update, and an update on succession planning. The committee also reviewed its terms of reference. There were no items that came through the committee for board approval. Thank you.
Thank you, Saye. Although we have reached the end of our agenda and I declare the business meeting adjourned, before I sign off, I would like to make a few brief personal comments. I often speak of the excellent work being done by our volunteers, our staff, our physicians, our management, and our executive, led by Dr. Verna Yu. They are deserving of our gratitude. Today, I would like to give a special thank you to AHS's extraordinary board, who have the immense task of governing AHS, overseeing the management of its business and affairs. The board is comprised of a team of dedicated, bright, and selfless individuals who bring to the board table their various experience, wisdom, insight, diversity of thought, and an indomitable passion for the wellness of Albertans. To each of the board members, I say thank you for everything that you do, for your friendship and support, for challenging me and each other to ensure that we serve Albertans in the best way possible. Please keep up the excellent work. It is a pleasure and an honor to serve with each of you. And to everyone, thank you for joining us. Please be safe and well.
Together, we do amazing things every day.